Good evening, everybody. Just want to thank you all for being here. Tonight, we are fortunate enough to have had one company, and that's Genentech, to be able to support tonight's program. And not only that, but we have a patient advocate that runs around the country. His name is Paul Pelland, okay, and he does a lot of fundraising for MS Views and News. And all of his fundraising goes towards our rural programs or programs in small suburbia areas. So we want to thank them both, all right? Let's give them a round of applause. All right, tonight we have Megan Weigel. Does anybody know Megan? Wait, better question, does anybody not know Megan? Well, Megan is going to do something with you all later besides talk. I think she's going to do a breathing exercise with you. So I really, really hope that you could hold your breath for 8 seconds. If not, let us know in advance, all right? We don't want anybody passing out here. But I'm going to start you off. Megan is, I don't have my glasses, all right? Megan Weigel, she's a doctor and nurse practitioner. She's specializing in neurological care in Jacksonville Beach, Florida, where she brings a unique integrative medicine and holistic nursing perspective to her practice. First Coast Integrative Medicine is the name of her organization. She earned her doctorate of nursing practice from the University of Florida, where her research emphasis was on preventative health care. Megan was recognized as one of Jacksonville Business's Journal's 40 and Under Club, and as an outstanding young alumnus of the University of Florida. Woohoo! She goes for that one, right? Is that what they call the Gators?
I'm not even talking to you right now.
Oh, okay, sorry. And as one of the great 100 nurses of Northeast Florida in 2015, she completed a fellowship in integrative medicine at the University of Arizona in the fall of 2008, which complements her practice's focus on wellness and holistic care. I'm going to let Megan finish out the rest. Let's welcome Megan Weigel. You didn't want to talk to me. Why did you say thanks to me? Oh my God.
Thank you.
Missed it.
Hi guys, how is everybody tonight? Good. Today I really have the pleasure of talking to you about a combination of topics that are important to people living with MS, and I think they all go nicely together, especially because we are living in an era now when, in spite of all of the technology that we have to remain connected, I feel like we become increasingly disconnected because people are always on their phones. If you walk down the street in a busy city and everyone's like this, or you're in an elevator and everyone's like this. Now we have an excuse. When you're in an elevator and everyone's uncomfortable, they start. Now everybody's just on their phone, right? So in an era where we have an opportunity to become increasingly more connected, we're becoming more disconnected. And so at the end of my talk tonight, I'm going to give you some opportunities to become more connected in an online way, but still in what I think are meaningful ways with one another, and give you a lot of community resources. I'm also going to talk to you today about the different types of MS in a different way than you may have heard before. We'll talk about using complementary therapies and the benefits of wellness in MS. That was my fault, I'm sorry. Moved it away. And then how to access care and what the members of your healthcare team should look like. So how many of you are familiar with the terms relapsing MS, secondary progressive MS, primary progressive MS with relapses? Everybody's raising their hands, right? So the first thing I'm going to do, just very briefly, is give you a summary of how we get to having MS in the first place. These are pictures of cards. They're kind of little cheat cards that one can carry around that show the 2017 McDonald criteria for the diagnosis of multiple sclerosis. And if you see, so on the top page, what we see is a varying way that a person could present with multiple sclerosis. So if you come in to see the neurologist and you've had more than 2 attacks, you have more than 2 lesions in your brain, or you have had 2 or more attacks with more than 1 lesion in your brain, but objective evidence that you may have MS, then that's really all we need to prove that you have MS, as long as things look MSy. And that means that the lesions in your brain are characteristic of what we see in MS, and that your lab tests rule out other potential diagnoses. If you come in to see the healthcare provider and you've had more than 2 attacks, but only 1 lesion in your brain, then you need a couple of other things to actually receive an MS diagnosis. And those things are one of either dissemination in space or dissemination in time. So that means a lesion has to be present, representative of a clinical attack in a different area of the brain than that which you're having now. And you could have the presence of a symptomatic or asymptomatic lesion, which means you've got a white spot and an enhancing lesion at the same time. If you go to the doctor and all you've had is 1 attack, then it gets a little bit harder. You have to fulfill so 1 attack, more than 2 lesions, you have to fulfill some more criteria. And that could be dissemination in time with an additional clinical attack, dissemination in time by the presence of an enhancing and non-enhancing lesion. And what's kind of nice now, even though I'm sure you guys remember this and don't really think it's kind of nice, is that if you have spinal fluid that's positive for oligoclonal bands, we can now count that as a diagnostic marker. Now, if you present to the neurologist and you've had 1 attack and you only have had 1 lesion, we used to really call anything with 1 attack clinically isolated syndrome, but now we may be able to call it something else. We may be able to diagnose MS even earlier, which is why we like these criteria. But if you've had only 1 attack and then you have only 1 lesion, you have to fulfill criteria of dissemination in time and dissemination in space. So you can see it gets a little bit trickier, even when you have relapsing MS, depending on how you present and what your history is. Finally, if you come into the neurologist with a history of neurological disability progression from the beginning of your history with neurological problems, and you meet these criteria, so a year of disability progression and the presence of certain types of lesions, greater than 2 T2 lesions or positive spinal fluid, then we are able to diagnose primary progressive MS. And primary progressive MS may take some time to diagnose because you may have presented with 3 months of disability progression, not a year. So it does require some looking back. So this is not real, it's not real intuitive, right? There's a lot of steps involved and a lot of things that you have to be careful about when you're making an MS diagnosis, making sure that you have ruled in things and ruled out things so that you have the correct diagnosis. The benefit of these criteria are that you can diagnose a person earlier, and the hazard is that it's easier to misdiagnose a person. And so that's something that as MSologists or MS specialists, we work very careful to make sure doesn't happen, that the misdiagnosis doesn't happen, and that the correct diagnosis is given. Because a white spot is not just always MS. So that brings me to what I said looks probably familiar. So on the top left, you have relapsing remitting MS characterized by periods of relapse where a person usually goes back to baseline. Over time, about 50% of these people over 10 years will become secondary progressive MS. I think that statistic has changed with our current disease-modifying therapies, as well as the fact that we diagnose people earlier. So there's a greater proportion of people who have MS beyond 10 years and have no disability progression at all, which is awesome. And then we have primary progressive MS, which happens in about 15% of people, and primary progressive MS with relapses, which happens in about 5% of people. So this is kind of what you guys have been seeing for decades, right, with how MS is presented. So we're moving on to this. And I just said, what the heck does this stuff mean? Because on the left-hand side of both of these charts, you'll see the familiar terms like relapsing remitting MS. On the right-hand side of each chart, like clinically isolated syndrome and relapsing remitting MS. and then progressive disease, which could either be primary progressive or secondary progressive. How many of you are aware that as of a few months ago, most of the disease-modifying therapies are now approved for active forms of secondary progressive MS? Raise your hand if, and I'll just say it. There's only about 3 people in a room of maybe about 40 or 50 that are aware of that. And so these new definitions of types of MS have helped push that forward because there are people with secondary progressive MS who are still having relapses. They're acquiring disability in between those relapses at periods of time, but it's not just like you hit secondary progressive and it's all downhill from there, right? There are periods of stability. There are periods where nothing changed. And then, 15 years might go by and you think you're out of the woods and suddenly you have a relapse. I'm sure that's happened to some of you in this room. So these newer ways of defining MS actually focus on disease activity. So we talk about clinically isolated syndrome and relapsing MS as being active or not active. If you have clinically isolated syndrome that's active, it's relapsing MS because it's more than one attack or more than one lesion. And then we talk about progressive disease as being active or not active and with progression or without progression. And it basically just describes a period of a disease. So you may have secondary progressive MS that's not active but with progression. And what that means is over 6 months or a year or however long it's been since you've been assessed by your MS provider, you've had so not active with progression. You've had some decline in your mobility or maybe some cognitive changes, but your brain hasn't changed. Your MRI hasn't changed. I shouldn't say your brain hasn't changed. Your MRI doesn't show new lesions or atrophy or black holes that are new, and you haven't had relapses. And so that's confusing for a lot of people because you feel worse, you seem worse, nothing's changed that we can see. Right? So you could also have progressive disease that's active but without progression. So that might mean that you go to the doctor for your regular checkup, you think you have secondary progressive MS, and guess what? You've got an enhancing lesion on your brain. You're 65 years old. You are not supposed to have enhancing lesions anymore, right? You have an enhancing lesion on your brain, but nothing's changed with you. In like 2 years, your cognition's been the same, your mobility's been the same. So that would be active but without progression. Is this kind of making sense? And the way that it's assessed is it's not a permanent label. So it changes because your disease changes. And the changes have to be present for 3 to 6 months for us to consider them, this is what's happened to you in that period of time. So disease activity, MS being active or not active, is determined by MRI change or by relapse, and it can apply to relapsing or progressive disease. And then disease progression is assessed at least annually by an exam from your MS provider, by scores and scales, so things like the EDSS, the Expanded Disability Status Scale, or the MSFC, which is the MS Functional Composite, or the Symbol Digit Modalities Test. These things assess your cognition. And then possibly by what are called patient-reported outcomes. So these are questionnaires that you might fill out that are much more relevant to you than a lot of the questions we ask you, that let us know how you're feeling, how your quality of life is. Are you able to do your activities of daily living? What's your mood like? What's your sleep like? This type of thing. Disease progression only applies to progressive disease, and I'll go back and show you that, because if you have relapsing MS and you are no longer going back to baseline after your relapse, then you have progressive disease. So you then go into the category of secondary progressive. There may be periods of no progression, and that means that nothing's changing, and that's really good, right? What we love about our newer disease-modifying therapies is that we have been able to stabilize MS. So you're looking at outcomes for people where the majority of people will have minimal change within a 5 to 7 year period after taking certain medications. In small percentages of people, we're seeing improvements in mobility. And this is way better than we were doing 20 years ago, 15 years ago, even 10 years ago, just before our first orals came out. So now I'm going to move on to complementary and wellness therapies in MS. And I wasn't quite sure how to adjust the talk, if I should talk about the team first, but I'm going to go ahead and give the complementary and wellness therapies a good talking to, so that you can see how this might fit into your healthcare team. Healthcare, wellness care is not just about treating diseases. It's not just about preventing diseases. It's about living a happy life, fulfilling your purpose, and having good quality of life. And that's where complementary care really does a great job. It does a great job with a lot of things, but that in particular, it does a great job with. So CAM is the other name for complementary and alternative medicine. It is a non-mainstream practice when it's used with conventional medicine. That's complementary medicine, right? They complement each other. So that is me. I'm Megan. Yesterday or Monday, I went and saw my primary care physician for my annual wellness check. And this coming Monday, I go see my acupuncturist. So I practice complementary medicine. Alternative medicine is a non-mainstream practice used instead of conventional medicine. So alternative medicine would be me, Megan, going to see, if I get a cold, I go to see an energy healer instead of going to my physician or PA or nurse practitioner. Does that make sense? So complementary and alternative medicine use in MS is used by about 30 to 80% of people living with MS, and these are fairly old statistics. So I would imagine in today's day and age that the statistics actually higher. People are more likely to be female, have a higher level of education, and report poorer health. So that poorer health means people usually go seeking for things that are outside of the normal standard of care. 90% of people who use CAM also use conventional medicine, but with MS and many other things, they may not disclose that to their healthcare providers, unless you ask, right? So I'm in a practice now where I practice integrative medicine. So I'm doing conventional medicine, all the usual stuff, and then I'm doing integrative medicine, which is talking to people about mind, body, spirit, nutrition, exercise, supplements, and botanicals if necessary. So the question that comes right after what medicines do you take in my practice is what supplements do you take? Tell me your vitamins, your herbs, your supplements, the shakes you drink, the protein powders you use, because there's all kinds of stuff in those things that you guys might not even know about. So I'm asking, but a lot of people aren't asking. And so they don't know that I have an 86-year-old patient who takes 20 supplements a day. Do you know how much that costs a month? I tried to get her off 2/3 of them, and she had anxiety over it. So, okay, I tried. Tried to give evidence. But given that natural products are the most common type of CAM used, those are supplements. Natural products are supplements. It's important to know that certain herbs and vitamins might theoretically worsen MS, things that boost your immune system. Your immune system works wrong. You don't want to help that out. So things that might boost your immune system or interact with, many things interact with medications, including the immunomodulatory and immunosuppressant meds that are like many of our monoclonal antibodies now can have drug interactions with some very traditional botanicals that are used. So it's really important that your providers know what you're taking. So these are the most common types of complementary and alternative medicine used in the general population in the U.S. This survey was done in 2012. The most recent survey actually only assessed yoga, and I'm okay with that because I love yoga and I do yoga with people with MS, but I wish they'd run the whole gamut again. But the top most common things are natural products like supplements, deep breathing, which we're going to do, yoga, tai chi, and qigong, which are Eastern forms of movement therapies, chiropractic and osteopathic care, meditation, massage, special diets, homeopathy, progressive relaxation, and guided imagery, the majority of which is harmless. Some of these things can be harmful. And so I like to think about using reliable resources for finding complementary and alternative medicine evidence in MS. And I also like to think about, I'll come back to this slide, I also like to think about choosing the right thing for you. So using reliable resources is very important. I love the book Complementary and Alternative Medicine and Multiple Sclerosis by Dr. Alan Bowling. He has a newer book that is specifically written for people living with MS. I like to think that he's my mentor, but he might cringe if he heard me say that. But he's a wonderful man who has spent his life researching and taking care of people with multiple sclerosis. And he has actually cataloged almost everything out there that you could imagine to see if there's any evidence in MS. And we're going to look at some of these links here in a second. So, yeah, that'd be great. So the reviews of available research. These are how you can find reliable resources. This is Dr. Bowling's website, and I think you'll have access to this presentation. So you can actually go to the presentation and click on the hyperlinks. But he has listed in alphabetical order all of the things that you might possibly hear about with complementary and alternative medicine and MS, and told you what the evidence is. And some of it might be that there is no evidence and that there's a theoretical potential for harm. And then it's up to you and your provider to decide whether or not that's something that you want to try. Okay, next one. So this is the National Center for Complementary and Integrative Health. It's one of the centers through the National Institutes of Health. They do a lot of research. They go around the world studying other forms of medicine that have been really deep-rooted in cultures for centuries. They try to figure out why placebos work. They really do a lot of wonderful work. And this is another very reliable resource where you can search for education about certain topics. And then the next one. Good. So you'll be able to click from your notes to these links. I put them in because I thought they'd be helpful. This is the University of Arizona Center for Integrative Medicine, which is now the Andrew Weil Center for Integrative Medicine. You can look for topics here. You can search for integrative practitioners in your area with a search tool. And this is my school where I train as a fellow in integrative medicine, and I firmly believe that they offer great evidence-based resources and also use their hearts to care for people. Okay. So this is my algorithm for deciding whether or not you should choose to use a form of complementary and alternative medicine. I thought I was really smart when I made this, but I'm not. There are people way smarter than me who actually came up with an acronym for it, but I kind of like the way mine works, so I'm going to use it. So research in complementary and alternative medicine is difficult for many reasons. One, there aren't big pharmaceutical companies making things. There's not billions, it's not $1 billion industry per type of complementary and alternative medicine. Many of the companies are multi-level marketing companies, which is fine. But again, nobody has the money that the big pharmaceutical companies have to take on the research. And even people who really would love to do the research don't have the resources to be able to do it. So how do you know what might work for you? So if, let's say you want to, anybody take a supplement they like? Yes. Turmeric and curcumin. Perfect. That's a great one. So let's run turmeric and curcumin through this algorithm. Is there evidence that this is helpful for an MS symptom? No. So if yes, I'd proceed. If no, I proceed to question 3. If there's no evidence and you want to try it anyway, is it harmful or costly? And the answer is no. It's not costly. You can get fairly good brands of turmeric at your local health food store. It is unlikely to be harmful unless you're taking blood thinning medication, and then you should talk to your healthcare provider about it. And it may be helpful for things like osteoarthritic pain, for inflammation in general. And when I speak of inflammation in general, I'm speaking about it at the cellular level. It may be helpful for inflammatory bowel disease. It may be helpful for pain. It may be helpful for cognition over time. These are all maybes, but it's certainly not harmful and not costly. And so if it's not harmful and not costly, you can go ahead and try it. If it were harmful or it were costly, and I consider financial harm, right? So if it were costly or harmful, then we could say, well, what is it that you're trying to do? And is there something else that you could use that would be safer or cheaper? You get the gist there? And so let's do I'm going to come up with one in my head that many of you might have heard of. And it's a botanical that I love. I think it's very useful. It's called ashwagandha. Have you guys heard of ashwagandha? One person. Okay, so let's do instead vitamin C. Who hasn't heard of vitamin C? What? So it's cold and flu season, right? So let's talk about vitamin C, emergency, Zicam, echinacea with every vitamin in the world in it. Let's talk about those preparations, right? So is there evidence that this is helpful for an MS symptom? No. B vitamins, some people say give them energy. And I'm talking about B vitamins right now in combination with the echinacea and the high-dose vitamin C. If there's no evidence and you want to try it anyway, is it harmful or costly? These things aren't really costly, but they're potentially harmful because high doses of vitamin C theoretically are immunogenic. So they stimulate your immune system, they boost your immune system works wrong. So there's an example of, let's try something else. Now that being said, you probably could take emergency or echinacea for 3 to 5 days and be okay. But you don't want to, it's not something that you take long term. I know people who take those things all the way from October through March, and that's probably not the best thing to do with MS. Let's see. I think that kind of covers it, but it's a nice way to think about things. Does it work? Yes or no? Is it harmful? Yes or no? And then is it worth a try? And part of that harm should be a drug interaction list with your other medications. So let's talk about brain health. This is a big buzzword. The Cleveland Clinic has come up with the 6 pillars of brain health. This is something that the Alzheimer's organization really started talking about several years ago. And we're not here at an Alzheimer's Association talk. We're talking about multiple sclerosis. But guess what? Time is brain in multiple sclerosis. And all of the things that affect your brain that can cause other diseases can also then hasten or worsen multiple sclerosis. So brain health is key, and brain health is a big part of complementary and alternative medicine. The 6 pillars are physical exercise, food and nutrition, medical health, sleep and relaxation, mental fitness, and social interaction. And so the way that I look at physical exercise is that a person should move their body every day. I've started talking about movement instead of exercise because exercise seems to it gives people that same look on their face that the word diet does. Like, I like to talk about food and nutrition, not diet, right? Because it sounds like something you have to do, and it's going to be painful, and you're going to end up wanting things. And I feel like many people feel that way about exercise. So I've started to talk about moving your body, and moving your body in a way that you enjoy, that allows your heart rate to get up, and that may improve your muscle strength and therefore your bone density. And if you cannot move your body, then you have someone moving your body for you, working you through range of motion exercises and stretching exercises. And Jeff is going to talk about all of that loveliness without saying exercise. I'm just kidding. Next. So food and nutrition is another pillar of brain health. So turmeric and curcumin that we just talked about, turmeric is actually a spice. It's not really a supplement, it's just a spice. And to get the benefit from it, the medicinal benefit from it, you really need to take it in the amount of a supplement, or else really put a lot of it on your food 3 times a day. Food and nutrition is extremely important. We know that a healthy Mediterranean plant-based diet is associated with a lesser risk of heart disease, Alzheimer's. It's associated with better outcomes in MS, and that tends to be the way I advise people to eat, is a plant-based diet. You may or may not choose to eat animal protein, seafood, but most of the food on your plate should come from plants. Medical health. This means going to your primary care doctor once a year and as needed for other opportunities, unfortunately, if they occur, like I have strep throat or I have the flu, or maybe I have something new going on with my another system in my body, as well as your other specialists that you might have to see because of other medical challenges. Sleep and relaxation is huge. So they actually have done several studies on sleep, and even decreasing sleep by 1 or 2 hours a night can cause impairment in cognition. So most of us sleep too little. Many of us do not sleep restfully. Sleep and relaxation are key to allowing the body to rest, allowing the brain to rest, allowing your mind, body, and spirit to rest instead of always being revved up and ready to go. That's the way we tend to live in our country these days. Many people have issues settling down at night, and I like to talk about a good sleep routine or a bedtime routine that involves not watching the news, not watching scary mystery shows, not reading scary books. If you're going to take a device, a smartphone, a tablet into your bedroom at night, I would encourage you to wear the blue light blocking lenses. You can get them on Amazon for $12. I ordered a pair today. The blue light that comes off of computers and phones and tablets actually impairs melatonin in the brain. So when my husband likes to read on his phone, so he's sitting in bed reading on his phone, and then he has a hard time going to sleep. Part of it's because he's reading the news, but the other part is he might need blue light blocking lenses. So creating a bedtime ritual that enhances calm. So you get that stuff that kind of gets you amped up, out of the way for the hour before bed. Put on some relaxing music. If you like essential oils or certain scents, you can use those to relax your body and your mind. Maybe you take a bath if that's in your ritual at night. Maybe you drink some sleepy time tea or some chamomile tea or some just whatever tea is herbal and not caffeinated that you like to drink within a reasonable amount of time before bed, so that doesn't keep you up all night. But creating a routine that allows you to calm down before you go to sleep can be really helpful. Mental fitness basically means staying mentally active. So that means staying involved with your community, maybe learning new things, reading, doing crossword puzzles. People always ask what games are the best thing to do for cognition and MS, and the truth is there really isn't a special one, but we know that keeping your mind active and learning new things stimulates neural pathways. So we encourage you to do that. And then social interaction is huge. So coming to things like this really makes a difference for brain health. We need each other, and we need community, and we need to feel like people understand what we're going through and that our stories are valuable. And that's extremely important for healing. They actually, at Cleveland Clinic, have a brain checkup quiz that's really cool that you can take. You do have to put in some demographic information because they are using the information to track results. It's anonymous, but they're using information to track and follow results. But this is the website that you go to. So you can register for the brain checkup, get questions answered, you can track your progress, and these are the 6 pillars. So I took the quiz, and I'm pretty healthy, and I think my score was like 86 or something like that, because I have anxiety, and I don't sleep enough, and there's a chocolate chip cookie in my car. Shh. You have to live a little, but it's a really great way to monitor your progress, and then you can see what areas you really need to focus on to make changes, and these changes benefit your life with multiple sclerosis. This isn't just about like, oh, I don't want to get Alzheimer's one day. This is about benefiting your life with multiple sclerosis, and taking a look at these 6 pillars can really help do that. All right, so how to create your care team. Your team can be huge when you live with MS, and it can get really daunting and overwhelming when you think about all the doctors that you might potentially have. And the thing that I like to talk about is it's better to have them when you need them than to try to find one when you really, really need them. So I don't know about you guys, but to get in to see just a primary care doctor where I live in Jacksonville as a new patient is like a 3 to 4 month wait. To get in to see a neurologist as a new patient can be 3 to 6 months. Same thing with urology. Orthopedics tend to get you in pretty quickly, I think, because they're used to acute visits. But just think about, having your 4th urinary tract infection of the year and having a lot of bladder pain and issues. And your neurologist says, well, I really think we need to get you in to see the urologist, and you've got to wait 2 months. So and people will often push it out. They'll say, oh, well, I feel better. I don't need to see that doctor anymore. Just go see that doctor so that you're established in the office. And then if you ever need them again, you get in a lot faster. People on your healthcare team, on your wellness team, let's call it a wellness team, right? Because there's just too much talk about sickness, and we want to talk about being well and being healthy. So the first person on your team is you. The second bunch of people are your support system, and this could be your family, could be your friends, it could be your MS community that you have at support groups, at dinners like this, or even online. It could be any other community that you're a part of, like your church or an exercise group. And then you have your neurologist or your MS nurse practitioner or PA, your MS nurse, then your primary care provider, rehab specialists like PTs, OTs, and speech therapists. And you guys, depending on your journey with MS, you might know your physical therapist pretty darn well. We talk a lot in our provider community about the unsung heroes in our lives, like our hairdressers, the guy at the cleaners, and very often, because our rehab professionals are spending so much time with you, they have very important information, and you tell them things. So they're a very important part of the team, and we call on them, man, when we're in a pinch. Specialty providers like urologists, orthopedics, physical medicine, and rehab, which are physicians who can help you with mobility challenges and changing needs over time. OBGYN, if you're a woman, hematology and oncology, which many of you may see because of the MS therapy that you're on and the need to go to an infusion center, and maybe the hematologist oncologist wants to see you first. And then you have your exercise team, which is really important. And some of you might have a nutritionist or a dietitian that you work with. Some of you may have a health coach or a wellness coach. And then mental health providers, which definitely don't deserve the last slot on this chart. Psychiatrists, psychologists, social workers, pastors. These are folks that are in the trenches with you when you go through hard times or if you struggle with chronic depression or anxiety. These are all people who you need on your team. At some point, you may need these people on your team. And why, you say? Well, studies show and tell us that comprehensive care in MS creates empowerment among people living with MS. It decreases care fragmentation, and it improves communication. So when you go to a comprehensive care center where everything's under one roof, it's a lot easier for referrals to happen. If you don't go to a comprehensive care center, because they are hard, they're not in every city, you're seeing someone who maybe is a partner in care with the MS Society or just a doc who's really good, they're well connected in the community. And they talk to your other providers. They share communication among people who know and care about people living with MS. Specialty care ensures proper assessment. So I've been asked the question, I'm going to use the urology thing because that just always seems to be it. UTIs are pretty common in people living with MS, and at some point you say, I think we need to have you see a urologist, have some testing done, see if they have any input, because we've tried some medicine, it's not working. We've tried some lifestyle changes, they're not working. We've done pelvic floor rehab. And you may say, well, I don't want to see a urologist. Why can't you just keep taking care of this? Well, your MS doctor or nurse practitioner or PA wasn't trained to be a urology specialist. So there are physical assessments, tests, and perhaps even some medicines that they just don't know much about. And can you imagine going to your urologist and saying, can you just prescribe my MS medication? So, it's just important to, if things are, say, spiraling out of control with another system in your body, that you see the right specialist for it. Primary care, because not everything is related to MS. And this is important on both sides of the coin, because I used to hear all the time, we get a phone call, Dr. Megan, I've got a cough, should I come in? You probably have a virus, upper respiratory infection, call your primary care, see if you can get in. Call back 10 minutes later. I called my primary care doctor and they said it's my MS. It's not your MS. It's an upper respiratory tract infection. Certainly, if it gets out of hand, it can affect your MS, and you probably feel really crappy because you have it. But it's an upper respiratory tract infection. So you want to be sure you're established with a good primary care doctor that understands, what is MS and what isn't. There's also a greater risk for vascular conditions and conditions related to sedentary lifestyle, like overweight and osteoporosis. Vascular conditions are things like overweight and obesity, diabetes, high blood pressure, high cholesterol, coronary artery disease. Greater risk for those in MS. And so we want to make sure that you're getting the right screenings depending on your age and your sex for those conditions. And then preventive care, which is basically to prevent those things I just talked about from happening. So checking in with an eye doctor once a year. Checking in with your gynecologist once a year. Getting your mammogram on time. Getting a colonoscopy when you need it. Because those are the things that actually are proven to prevent a disease or to catch it early. So how do you find these people? I don't have any links here. Okay. So the National MS Society's MS Navigator program is a great place to start, especially if you're new to a community or if you're looking for a new doctor. I put the number right up there. They have certify practices as partners in care, and the partners in care practices, their providers have shown that they've received special education and have special expertise in treating multiple sclerosis. So they're experts in the field. Talk to your providers, your family, your friends. If your doc wants to refer you to a provider, ask them, say, well, is this just the only one around, or would you let your wife go there or your sister or husband go there? Consider traveling. So Ocala is a fairly central location to some major cities with good medical care. And since I know that people outside of Ocala will be watching this, if you live in rural areas, consider traveling to a larger metropolitan area if you think that you need a different level of care. It is your right to seek second opinions and new provider relationships, so it's your right as a patient to do that. And I do encourage people to do that even in my own practice. So if you aren't satisfied with the care you're getting, then it's your right to look for better care. And you could even consider paying out of pocket for care. I have a high deductible insurance plan, and I went to urgent care, gave them my insurance card. They ran it. I had to pay to my deductible. But if I'd gone in and not given them my insurance card, I would have paid more than half less than what I paid with my insurance. Is that making sense? Maybe I shouldn't say that on TV. But the point is, even with medication at the pharmacy, and this is totally kosher, you can say, can you run the price of that without using my insurance? And there are medications that will be cheaper than if you use your insurance, depending on your copay plan. So these are just some ways to help with costs. Another big one is imaging. Depending on whether or not you think you'll meet your deductible for a year, you could ask for the self-pay price on imaging, MRIs, x-rays. It's markedly lower than if you have to pay up to a certain point to meet your deductible. However, it then wouldn't go towards your deductible. The MS Association of America, since I'm talking about imaging, has a great MRI fund that you can apply for MRI assistance for, even if you do have insurance. So those are just some ways to find a good team. And then, yes, I am a Gator. It's now very obvious. You may not always need to call on special teams, but they practice anyway. And so that's sort of my theory about your MS team. It's a good idea to practice with them so they get to know you, they understand your challenges, and then when you need them, they come in and they score the touchdown, right? I know very little about football, by the way. So I'm going to talk about community at large resources now. And this was really my favorite part of the talk to compile because it's a struggle to find information. And it is a struggle to find to even get people at certain organizations to tell you the right thing and to tell you what you need to look for, to tell you who you might call. I'm not sure why that is, but it can be hard to find resources. So I spent some time the other night on the internet, keeping in mind that again, there will be people outside of the state of Florida watching this talk, and certainly I'm not in Jacksonville anymore, so I didn't want to cite those resources. But one of the things that people that I work with have the hardest time with is transportation. For example, they live in Duval County, and their physical therapy is in St. Johns County, and public or community transportation, paratransit, will cross county lines. So there's all kinds of rules that you have to work around when you're looking for transportation help. So let's do the first one under transportation there. Elder care is a really great resource, even if you are not considered an elderly person for transportation. You can call and ask for resources, and you can even, I believe, put in the state that you live in, and it will take you to that state's website for transportation assistance. Okay, that's good. Bill, thanks. State Department of Transportation website. So we're in Florida here. So the Florida Department of Motor Vehicles has links to cities, or I should say counties, transportation assistance programs. Most of these are done by county, and they usually include like a dial a ride type option where you can schedule a ride. They also include paratransit and a bus type system, or maybe even provide free busing for people that can ride a bus. And then Uber and Lyft. Do you guys have Uber and Lyft in Ocala? Okay. So Uber and Lyft in some cities have accessible transportation, which is pretty awesome. So they can, some people have vehicles where you can put a scooter or a power chair or a wheelchair on the car. You just have to inquire about that. So those are some resources for transportation that I thought people might find helpful. And then the second, the middle column there is what I'm calling connection. So you guys have a support group in Ocala? Yes? No support group in Ocala. So you come to things like this for connection with each other, right? Or maybe you go to Gainesville. I think some of you go to Gainesville, yeah, for connection, for dinners like this, and people watching on TV may or may not have a support group, may go to a neighboring town for community MS support resources. But how many of you use the internet for community? So Facebook groups, blogs. I see maybe like quarter people raising their hands. So I just want to give you some resources. So locally, the National MS Society and the MS Foundation support groups in cities. And you can go to their websites and you can go under resources, support services, and find the closest support group. There are also a lot of online support groups, if you can click on that. I just chose the National MS Society website to look for online support groups, but they actually have msconnection.org where you can connect with other community members. You can search for a peer to connect with, and then you can hop on chat rooms as well. So that's one source for an online community. Facebook groups are another great source, and I know that if you guys have a good Facebook group, yell it out so I can say it into the computer or into the Original Good News is a good Facebook group. Anyone else? I like that name. Many of the pharmaceutical companies also have Facebook groups specifically for people taking their medication. So depending on what medication you're taking, you may want to call the nurse resource and ask what the Facebook group is called. Peer support is available through the National MS Society and some of the pharmaceutical companies, which means they actually train people who are on the medication that you're taking, who look like you specifically with MS. Like maybe they're a 50-year-old guy who was diagnosed 10 years ago, is still working, has kids, or maybe they're retired and not sure about what they can or can't do. So they try to match you up with people that understand your journey because they're going through it too. Instagram is another great resource. And I'm okay right now. I'm trying to remember all the things that I wrote down, and they're way over there on the other side of the wall. So I put out a request on Instagram. It's just the platform that I use the most these days for people to give me people to follow on Instagram that were uplifting. And so I really love Channing Barker. It's at Channing Barker. She loves Damian Washington at Damian Washington, who actually is on MS Views and News, the website right now. When you go to the website, he's the guy talking in the middle in the video. There is a physical therapist who specifically works with people named people with MS, and her name is Gretchen, and she's at Dr. spelled out DOCTOR .Gretchen. And so if you follow these people on Instagram, you basically see what they're doing, what positive things they're doing. They're always posting positive affirmations, ways to get help, challenges that they're having, and then they hashtag different things. And so hashtagging allows you to then see other posts that are doing the same things. And some of those hashtags are MS Warrior, End MS, Sick Not Ugly, Spoony Life. You guys know what the spoon theory is? Okay. And basically, let's see, Cure MS, FMS, excuse my French, multiple sclerosis. And you can also follow, it's MS Views is the Instagram handle, right? So at MS Views and News is the whole handle, MS Views and News. But on Instagram, it's the okay. So at MS Views and News, thank you. And you can follow each of the patient advocacy organizations as well on Instagram. And that's just a quick, Facebook's a little bit longer, Instagram's a little bit quicker.
There's one called MS Buddy also.
Facebook group, that's the one I'm thinking of. Facebook group MS Buddy, that's the one I've heard about for years.
They actually have it's like an app you can put it on your phone.
Oh, that's great. So there's an app for MS Buddy too. Cool.
And
Thank you.
It matches you, like you put in all your symptoms, what you're going through.
Uh-huh.
And it'll say, oh, we've matched you with.
Oh, and it matches you with a person, like a peer support person. That's fabulous. Thank you for that. And then there are, fundraising events to become involved with. And you can even get involved in fundraising virtually these days. So you can swim MS for the MS Association of America. You can ski MS for Can Do MS. You can bike, walk, mud run for MS for the National MS Society. So there's a lot of ways that you can get involved with fundraising that don't necessarily have to be you doing these activities. They can be your family members, your friends that live in other areas. Education is... it's really not hard to find good education, but somehow people manage to not find good education. So I'm going to list out all of the sites that all of the sites that I think are very reputable, direct you to other reputable resources, and also will steer you away from information that is not truthful. So we have the National MS Society, we have MS Views and News, we have the MS Foundation, the MS Association of America, Can Do MS, and Can Do MS actually hosts quite a few webinars and phone calls. One of the initiatives last year, out of it actually came a virtual support group for care partners and one for people living with MS. So that's another connection, virtual connection. The Consortium of MS Centers has research available that you can read, up-to-date information. It's meant for providers, but you guys have this disease and run around with it all day, and I encourage you to go look for the good information and the good research. International Organization of MS Nurses also has a lot of free information that's meant for nurses on their website, but it's still really great to see what's happening in the community, and many people living with MS are healthcare providers. And so if you are one of those and your license is still, you want to keep your license active, you can get CEUs at both of those websites. The Veterans Administration has some great education for people living with MS and has centers of excellence all over the country. If you're a veteran and you haven't checked in with the VA about what your resources are for MS, I encourage you to do so. And then the United Spinal Association is traditionally an organization that it was created for people with spinal cord injury, but we do a lot of work with them as the MS Coalition because we're dealing with similar issues. Did I leave out anything, Stu? MS Coalition. MSCoalition.org is the one I left out, which basically is a combination of all of these organizations that comes together to educate and advocate for people living with MS. So with that, I'll close and take questions. This is my little guy. Here's a picture. I loved this quote. I love quotes. I have books of them all over my house. Once you choose hope, anything is possible. Christopher Reeve said that. And I truly believe that in today's era, that one of the things that we're missing most is connection. One of the things that we focus least on is probably the most important for healing, and that's mind, body, spirit. And with that,
let's say thank you to Megan.
Oh, I'm way over time.
Oh no, you gotta do your first.
I was gonna. It's 19 seconds.
Yeah. Go ahead.
Let's rush through this mind, body, spirit activity.
All right, let's thank Megan first.
So everybody, thank you. Everybody, swallow your food. Take a sip of water. I'll give you a few seconds. I'm used to, the clock, the fancy clock, and all the things.
We have room in here. We were expecting a larger room.
And then once you're done swallowing and you've had a drink of water, just take a deep breath in and a deep breath out. Sigh if you want. Sighing feels so good. It feels so good. And then just breathe normally while I tell you what we're going to do. So we're going to do this 4-7-8 breath. You are going to close your mouth. You don't have to do it yet. Just listen to me. Breathe in through your nose to a count of 4. You're going to hold it for a count of 7. And then you're going to open your mouth and breathe out for a count of 8. It's okay if you make noise. If you want to, that's fine. 19 seconds. If you aren't used to breathing exercises, doing this twice can actually make you dizzy because it tampers down your sympathetic nervous system so much. All right, so everybody take a regular deep breath in and a regular deep breath out. And now inhale through your nose. 2, 3, 4. Hold it. 3, 4, 5, 6, 7. Open your mouth. 3, 4, 5, 6, 7, 8. That's it. So you have the little magnets. Remind you to do that. You can do that at a stoplight. You can do that when you're on the phone with your mother-in-law or your daughter that's driving you crazy, or your boss. But I'll leave you with that. I thank you for your attention. And I guess, do you want to do questions or do you want to jump?
We're going to do Q&A now, all right?
Okay.
So, again, let's first thank Megan. Everybody give her a round of applause. There you go.
Thank you, guys.
She's one of our favorite speakers, If she didn't have Dane, she'd be traveling all around the country. And she was supposed to bring Dane here tonight, and I'm upset that he's not here.
You guys are glad he's not here, trust me.
Okay. So, anyway, I'm going to go around the room. I'm not running. I don't know if you noticed I have a boot on, but I'm not running around the room, all right? So if you have a question, please raise your hand, all right? And we do have to have one brave person start. And if you all don't, then that means I have to, all right? But, okay, that's there. There we go. All right, do me a favor, though. Raise your hand. Wait for me to get to you. There's germs in the air. I'm the only one holding this microphone, all right? Thank you.
I will just talk loudly. All right, there is so much talk about gut bacteria these days and
Yes.
probiotics. Do you suggest to your patients that they take a probiotic pill, capsule, whatever?
That is a fabulous question. And the answer is to some of them. So if they're actually really studying the microbiome in MS, and they know for sure that your gut bacteria when you live with MS is different than the gut bacteria of a person that's healthy without MS. And by healthy, I mean doesn't have any other medical conditions. They also know that when they give you a probiotic to try to make that gut look healthy, like a person without MS, it works for most people. And then so what does that mean? Well, we hope that translates to less inflammation, to the immune system staying in the gut where it belongs instead of you have immune cells everywhere, but there's a leaky gut theory. People are probably cringing watching this if they're traditional medical providers, but the leaky gut theory is that the immune system that's in your gut is able to get out where it doesn't belong and then attack things that it shouldn't, and that's one of the reasons behind autoimmune disease. It's a theory. I think that I choose probiotics very carefully for people because different strains of probiotics can help people who are having constipation versus diarrhea versus issues with infection. The one thing that I will say about probiotics is that you should be careful with them if you're on MS medications that cause your absolute lymphocyte count or your white cell count to go very low. So it's because they're bacteria, right? So if your body doesn't know how to fight it off, an overgrowth of even good bacteria can be harmful. The probiotic that was used in that study that I mentioned first, that really is what got people thinking about the microbiome and MS, is VSL number 3, which is no longer available, but as that brand, it's available as the brand Visbiome, VIS Biome. You can get probiotics in foods without taking a pill. So fermented dairy like kefir, Greek yogurt, fermented vegetables, sauerkraut, kombucha. Oh my gosh, kimchi is like Korean sauerkraut. All of these things have pre and probiotics. Certain types of fibers that we eat have prebiotics. So you actually can get these things from food if you don't want to take a pill. Good question. Thanks.
Megan, if you research prescription meds for osteoporosis, you get scared with all the side effects.
Yes.
Are there natural ones that you can recommend that have been found to work?
So no. I mean, there just aren't. But what has been found to work, as far as bone health goes, is weight-bearing exercise. So that would be right up Jeff's alley. He'll talk to you about it. But weight-bearing exercise literally is what it means. So walking, even using small hand weights or ankle weights. They don't have to be heavy. Depending on your age, your doctor may recommend that you take calcium, vitamin D, K2, which can help with those things being absorbed. But you also don't want to start taking calcium in middle age if you've never taken it before, particularly as a woman, because it can be bad for your arteries. I would say that a healthy plant-based Mediterranean type diet is also pretty good for your bones. But from the standpoint of supplements, you're not going to find one that has outcomes like the medications. But I agree, the side effects can be pretty scary.
Anybody in this room? Before I run around? No? I got one for you. Somebody in the room, or in the building, I should say, asked me to ask you a question.
Yes.
And they want to know when is the right time that they should know that they should be using medical cannabis.
Like time of day or time in their lives?
When is the MS, when their pain is bad enough?
Oh, gosh. Okay, so this is a question about pain and medical cannabis. So it's a pretty loaded question. I mean, it depends a lot on your belief system. Many people turn to medical cannabis because they want to come off of opiates. Many people don't want to take opiates, so they turn to medical cannabis. I think an appropriate time is when your pain is not managed by the things that you're doing and you either don't want to escalate therapy or you can't for whatever reason, or perhaps you have a harmful effect from what you're currently doing. So for example, you're eating ibuprofen or naproxen throughout the day, you end up with a bleeding ulcer. It helps your pain. You don't want to go on opiates. Steroid injections aren't an option for you depending on where your pain is. Perhaps you've tried many different alternative modalities. So some other things that are very helpful for pain can actually be physical therapy, massage therapy, depending on the pain, acupuncture, guided imagery, music therapy. These are all things that are along that same line of moving to a complementary and alternative therapy, which medical cannabis would be considered. So I think it just depends on what your belief system is and what your goals are.
So the question also was that her pain, she's got spasticity, she's got a burning pain that she always has. Are those reasons for, to be using this kind of?
Yeah, so medical cannabis certainly isn't it's not a blanket. So in multiple sclerosis, we have data from small studies that tell us that oral cannabis extracts, which are medical cannabis, not the CBD that you can buy at the health food store, certainly not at the gas station or from your neighbor. So medical cannabis, that which you need a card for. Data that supports its use for treatment refractory neuropathic pain. So the buzzy, tingly, pins and needles, electrical shock, sharp type pain. For neurogenic bladder, so it can help relax the bladder, and also for spasticity.
And what is the difference, is asked, of why should she use medical cannabis over CBD?
Well, that's also a personal choice. So CBD really has very little human testing. There's a lot of evidence for cannabinoid use empirically, anecdotally, which means, you hear about it, it sounds good. When we look at the molecules under a microscope or in a petri dish, when we test them with animals, they seem like they might work. CBD these days seems to be a cure-all for everything, but it's also a supplement, and so you have to be sure that you're getting a good quality grade supplement. If you're paying, $10 for your CBD, it's probably not great hemp oil, or probably not great cannabinoid potency. Good CBD tends to be pretty expensive. I certainly encourage people, if they want to, try a reputable source first to see if that works. In town, in Jacksonville, we have a grocery store called Lucky's. Do you have Lucky's here? Or Whole Foods? You have a Whole Foods, okay. So the section of Whole Foods that sells supplements usually has pretty knowledgeable people. They're dedicated to that section, and they can advise you on brands. It seems like there's a medical marijuana shop just about every few blocks now in Florida. And they, I believe, sell CBD oil. I personally have not been in one to know. But if someone wants to try it and see if it works, really, it's worth trying if you're going to try a reputable brand, and that's a road that you want to go down. Keeping in mind that just like other supplements, it can be adulterated, let's say, with other things. A good percentage of CBD oil that you buy off the streets has THC in it. So you just have to be careful about the brand you buy.
Thank you.
Yeah.
Next, somebody wants to know about juicing.
Who might that somebody be? So I am an advocate for juicing for short periods of time. I think that one of the things that you lose in juicing is, depending on how you're juicing, is the fiber and the pulp that comes from the fruits and the vegetables. I do believe that eating whole food suits your body better than juicing. Our bodies were meant to eat whole food. So I think some of the benefits of juicing are that when you put food in a liquid form and mix it with other liquids, and then maybe you're putting some other things in it, that there is a diuretic effect. So you probably feel that, you've lost some water weight, and you're able to tolerate a lot more fruits and vegetables at one time, and so perhaps your bowels empty a little bit better. So there is definitely a short-term benefit to juicing from a weight loss standpoint. I think people that do juice say that they experience an increase in energy and mental clarity, better bowel function. But I also, it's not the quote diet, it's not the weight loss plan that I recommend. Let's just put it that way.
So you brought up about the vegetables. So there's, I was told recently that fruits are probably not a good thing to use as a dessert item because of the sugar content, and that I should use like snap peas and just greens, vegetables, as more of a appetizer, not an appetizer, but it's a dessert item.
Yeah, so you're talking to me as a middle of the road person, right?
You're at the top of the road.
I believe that life should be enjoyed. And if you're eating things like berries, so blueberries, raspberries, blackberries, strawberries, and you're not putting sweetener on them, you're just eating them in their natural, pure form, they are so full of phytonutrients and antioxidants that, certainly you're going to have less calorie and less sugar from a snap pea. But then if you get up at 2 a.m. to binge on Hershey Kisses because you had snap peas for dessert, who's winning? And I'm not saying you're going to do that. I'm just saying that if you're going to make a choice, you want to have dessert, and in your head you're thinking, gosh, I used to just have a bowl of ice cream. And you do need a little bit of, of a sweet that berries are not a bad choice to have. There is sugar in them. So then you throw in the whole issue with, do you have diabetes and that sort of thing. But personally, I don't have a problem with a person having, a half a cup of berries for dessert.
Okay, great.
That's my opinion.
You gotta wait. I gotta get over there.
Or cookies, right? Once in a while.
Okay, with exercise, you did not mention one of the things that 4 of us, at least in here,
Oh, tell me.
Hippotherapy.
Oh,
We all ride
hippotherapy is
once a week.
wonderful.
Yeah.
Well, you're in Ocala. It's the horse capital of Florida, right?
Wait, does that mean that don't you ride hippopotamus?
No, it's not
Really?
hippopotamus
Wow, oh my
therapy.
gosh.
It's HYPP. So horse therapy
That's a
is
needle.
wonderful. Yes. Wonderful exercise, wonderful mind, body, spirit therapy. Connecting with animals is an incredible experience. I think there's power in that connection. It helps with balance, with strength, with courage, with bravery. All those things are really important.
Great. Thank you. We got to end Megan's talk right now. It is running a little bit over, and Jeff does have to speak
Thank you,
next.
Jeff,
All right.
for letting
So
me
I'm
go
sorry,
first.
but we gotta just end things right now. So let's give her a round of applause. Yay! All right.